So a lot of people are in my DM saying, Dr. Greg, there's a new virus out there and you're not talking about it, you're not making videos about it, and it is consuming people. It's okay. Let us all cease fire. I am here now. The virus is known as dengue fever. Some people are saying dengue virus, but it's dengue fever. And this is the only virus that is transmitted by mosquitoes. I'm not saying it is caused by mosquitoes, but mosquitoes are the vehicles that transmit this virus. So how will I know that I am having dengue fever, or what is even dengue fever? So dengue fever is also known as the breakthrough or breakbone fever. And it's a viral infection. It's caused by a virus from a genus known as flavivirus. This virus have brothers like the yellow fever virus, and also it also have other viruses as its brothers, other 3 viruses as its brothers. But we are now focusing on the dengue virus. And this dengue virus, it has 4 different strains. You have the dengue virus 1, 2, 3, 4. You can get any of these. And in Ghana here, there have been reported cases. So you can look at the picture that is showing on my screen and you know that Ghana Health Service from last week have been trumpeting about this virus. Why is this virus so scary? It's because the symptoms of this virus is similar to that of malaria. And I know I could see an armor out there. Most of you, when you have malaria infection, you don't go and test. You say that, oh, maybe malaria and saying it here. You go and take medications. Now the problem with this one is that the symptoms looks like malaria. And why am I saying that? You have high fever, your temperatures can rise up to 40 degrees. You also have muscle pain, and mostly you get headaches, and the headaches mostly are around your orbital region or your pre-orbital region, so mostly around your forehead. You have muscle pain and all those symptoms. Some people get nausea and vomiting. So if you're having that malaria-like symptom, you've taken all your anti-malaria medication that you know, and it's still not going, then you have to be thinking of dengue fever. Now, how will I know that I have dengue fever or dengue fever virus? The dengue virus, for you to know it, you have to be confirmed. So there's a test that is done, is the IgG test, and also there's a PCR test. So when you have these symptoms that I've mentioned, you are a suspected case, you have to go to your hospital. Please don't self-medicate. So there is another part. Then the virus, it can be in a severe form. We have what is called the dengue hemorrhagic fever. So you can have one that you can also bleed if it's a severe case. That's why I'm here making this video for all of you to know about it. So now, how will you even take care of ourselves if you have dengue fever? Number 1, dengue fever has no cure. So we don't have medications that cure it. Your body is supposed to fight against this virus. It's a viral infection. So your immune system is supposed to fight it. That's why I'm here. Because I know that Adjoa and Akus, they are pregnant, and because of that, their immune system is low. I know that Akusika, he is having other conditions that his immune system is very low, and because of that, your ability to fight infections are very low, or your body cannot fight infections like that. That's why I'm here making this video, because your body has to fight this infection. So what you can do is what is called supportive care therapy or supportive care. So the first thing is you have to hydrate. Then you have to be, if you have high fevers, we'll give you certain pain medications, and even that one, your doctor has to recommend which pain medication that you're supposed to take, or antipyretic that will bring down your fever. Then your body will have to now fight this virus. So why don't we protect ourselves from even having dengue fever? Because if your body has to fight it, you can have temperature from like 2 to 7 days, and it's not easy. So please, let's protect ourselves. So what should you do? This is something that everyone has to be involved in. I know that it is raining, and when it rains, you know that there are mosquitoes that are being breeded. And with dengue fever, is being transmitted by a particular type of mosquito. It's known as the Aedes aegypti. And this mosquito, the female one, transmits this virus or this dengue fever. And this mosquito, it bites during the day and it bites during the night. And it doesn't bite only in the night. So you have to be very careful of your environment. Number 1, you have to make sure that you desilt all your gutters. Meaning, you throw rubbish into your gutters. Please stop that. You make sure that every container that contains stagnant water, if you are using it, make sure you seal it. Otherwise, you have to empty stagnant water in your environment. It can be a barrel that contains water that is not covered. It's advisable that you make sure you empty it so that mosquitoes will not breed into it. If you have a refuse dump around your area, make sure that you clear those refuse from that area or that rubbish from that area so that it won't be a breeding site for mosquitoes. Doing all these things and other personal hygiene makes you protected. And also, one thing you have to do is that you use mosquito repellent. You know, I talked to you about that odorless mosquito repellent that you refuse to buy. Now I think it's the time for you to get that mosquito repellent. I know some of you might have forgotten about it. I'm talking about this mosquito repellent. Yes, you remember it. You can get this one from any vendor. Then also, you have to use mosquito repellent. Then sleep in insecticide treated net. That's one thing that I know that Akwesi and Bismarck, you don't even like doing it. But at this point, make sure that you sleep in insecticide treated net. If you have children in your house, make sure that they sleep in insecticide treated net. If you are someone who treks or stay long hours outside, make sure you wear clothing that will prevent mosquitoes from biting you. Please, let's make sure that we keep our environment clean because the transmission of this virus is very, very rapid. And right now, about 3 regions have recorded cases, including Eastern region, the Greater Accra region, and the Central region. And only God knows how many people are having this virus. Dengue fever is here. Let us be careful. Let's be each other's keeper. And this is Connect with Dr. Greg. Make sure you like this video. Please do not skip to that content that will make you laugh. This is an educational video. Make sure to share, like, and follow me. Stay tuned for the next episode. Bye-bye.